Transmitting live from Brooklyn. This is Brooklyn Old Heads. The case of Dr. Susan Moore has generated outrage and ignited calls to address biased medical treatment of black patients in the nation's healthcare system. Dr. Moore's case adds a distressing emphasis to heaps of research evidence finding that black patients receive inferior treatment compared to their white counterparts, particularly when it comes to relieving pain. An insidious mix of socioeconomic and health factors have made COVID-19 especially devastating for black and Latino communities. Black people have died at 3.6 times the rate of white people, according to data analyzed by the Brookings Institution. Dr. Moore, originally from Jamaica, grew up in Michigan where she earned her medical degree from the University of Michigan Medical School. She had apparently grown accustomed to fighting for proper care before she tested positive for coronavirus on November 29th. Dr. Moore often faced challenges getting even a minimum care for a condition she had known as sarcoidosis, an inflammatory disease that attacked her lungs. Upon admission to the hospital for COVID-19, she had to beg for the drug remdesivir that some doctors use to treat COVID-19. Dr. Moore, she took to Facebook to report how white doctors at the suburban Indianapolis hospital where she was being treated downplayed her complaints of pain and denied her sufficient narcotic pain medication. Dr. Moore had received a scan of her neck and lungs, which she herself demanded, after her doctor denied she was short of breath even though she reported so. Dr. Moore was discharged from the hospital on December 7th despite her protest and complaint of symptoms. She was taken to a different hospital 12 hours later, where doctors there were said to have treated her better. Nevertheless, her condition deteriorated. Susan Moore had to be intubated on December 10th and was soon fully reliant on a respirator to breathe. 2 days after being intubated, she died. A profoundly sad case and perhaps a preventable one. Amazing how when you are a black person receiving treatment in the healthcare system, everyone can assume what's best for you, even tell you how you feel or what your symptoms are, even if you are a competent and knowledgeable black doctor. Notice how, even though she had a previous condition, the sarcoidosis, an illness that attacks the lungs, no one seemed to be more attentive but less responsive to Susan Moore's needs. Dr. Moore was able to document her poor treatment and decline in health through video and social media recordings. How many blacks and Latinos have succumbed to COVID-19 or any other illness who have not been so lucky as to document their mistreatment? Racism. When do they get a vaccine for that? But what about, Dr. Moore, Dr. Susan Moore, right? That's a compelling, I think, situation right there. Sad and compelling.
Sad and compelling. But it seems like minorities are always getting disparages in treatment. I'd like to say disparage. What?
The word is disparities.
Not disparage? Okay, disparities. Is that okay? Okay. So we're going to start again. It seems like within our community, the minority community, Black, Latinx community, there's always a disparities in treatment that we get when we enter your healthcare facilities, right? And I have a few questions. I wonder, is it an institutional thing that leads to us getting care less? Actually, I don't like that. Is it an institutional thing that leads to us not getting the care that other communities get? Or is it an individual thing? What's really happening there? Or is these misdiagnoses some way roundabout intertwined with capitalism to have us coming back, to have us, continually not healthy? Could that play a part in why our community is dying at 3.6 the rate of other communities? Is it because of our capitalism?
Could be touching a nerve. It's been well known that America's revolving door system of healthcare, much like its revolving door system of incarceration, is wasteful and is mismanaged. And I think you raised some good points. I think people should take a closer look at that. Maybe there is a more nefarious motive at hand, right?
Nefarious motive, and
Just tinkering, just guessing.
Just guessing, and it's not hard to believe that capitalism would play a part in our healthcare system.
Oh. Now, see here, mister. Nothing evil or negative could come as a consequence of capitalism.
Nothing at all.
Hush your mouth.
Hey. But it was glad, we're very happy that she was able to document that was actually happening to her, because she, even at her level of understanding of what's needed to be said, what treatment she required, even at that level, she still did not get it. And you have to wonder again, as I said, is it institutional or is it on an individual level? And a lot of times the institution can have the policies in place, but they're not enforced at the individual level. And you have to wonder, is it by purposeful or spite that this doctor, did they feel offended being told what needs to be done in that situation? Why she didn't get the care that she needed?
There's a saying I've seen actually, in some doctors' offices. I guess it's meant to be humorous. It says, the success of your care will depend upon which one of us is the doctor. Right? Meaning that if you're a patient, somehow you shouldn't advocate or shouldn't try to, I don't know, inform the doctor of your symptoms or what ails you.
Mm-hmm.
But in this case, you're making a very appropriate point. The patient was a doctor. She knew pretty well not only her symptoms and such, but she also was able to communicate in pretty complex terminology according to Facebook posts and the video. She was really able to, express her ailments and what was going on with her. But the fact remains is they denied or they downplayed her symptoms.
Glossed over. I'm sure they might have said, "Oh, you're quite articulate for a dying woman."
More like, isn't that cute? It's a black doctor. Oh, we don't see too many of those, do we?
Death.
Destruction.
And the funniest thing about it, as we're sitting here talking about Brooklyn, she's actually a Jamaican lady. Crazy as it is, and not very surprising. Not very surprising. Not that she died, but the whole circumstance of her being a doctor, her documenting it, and then dying in the documentation of this.
Wow. As I said in the segment, there are many people who are so less unfortunate because they didn't have the means to document this, such a sad case. I'm hoping not only that this report of hers, her documenting her plight, illuminates this, these disparities even more. I hope it also that the people responsible for her care, actually the irresponsible people,
Irresponsible.
they get prosecuted. Man, this seems like there should be maybe some legal charges.
Medical negligence, right? Is that
applicable? Listen,
applicable?
if it's not a term, they should make it one for this case.
3, 2, 1, and action!
Transmitting live from Brooklyn. This is Brooklyn Old Heads.